Hi, I'm Dr. Geetha Nair with Topline MD TV. Here to join me today is Dr. Danny Martinez, Topline MD urologist. Dr. Martinez, welcome to the program.
Thank you for having me.
So, Dr. Martinez, we wanted to talk today about men's health. We never hear enough about menopause, and we always seem to hear about menopause. What exactly is that, and what do our viewers need to know?
Menopause, or also known as andropause, is essentially testicular failure. Everybody and all the attention comes straight to the menopause. And menopause is important. Think of it as a wall. A woman hits a certain period, they hit that wall, and next thing you know, all their hormones drop, they feel terrible, hot flashes, etc. In a man, it's a little bit different, okay? In a man, andropause or menopause is not really a wall that they hit. It's this slow decline that we start somewhere maybe in our 40s. We reach a peak somewhere in the 20s, and for the rest of our lives, we're in this downward spiral.
So is there anything that men can do to stave this off?
Ultimately, no. We're all doomed. Same way, there's no way to stop a woman from going into menopause.
Part of the aging process.
Absolutely. Mother Nature. There's no way of stopping it. But there are some things you can do to try to make it happen later on in life. And obviously, these are things that we learn from a very early age, such as eating a healthy, balanced diet throughout your entire life, exercising regularly, not taking part in any sort of illicit drug use or heavy alcohol use or tobacco use. These are all things that will maintain not only good testicular health, but overall good men's health.
Now, you hear about a lot of men taking testosterone to help them through that stage in life. What are your thoughts on that?
I think right now we are living in an era where overuse of testosterone is becoming an epidemic, in my opinion. Perfect example.
Everyone wants a pill.
Well, that because everybody wants to stay feeling young, okay? And unfortunately, there really is no fountain of youth. And this is a process that's inevitable. You can't stop it. When I see a guy walk into my door that's 60, 70 years old, but he's got the body of a 20-year-old and he claims he feels great, and when you check his testosterone, it's 2 to 5 times the normal limit. Well, yeah, they feel great, they look great, but they're really rotting on the inside.
And what are the risks? What are the risks of having a high testosterone level?
Overuse of testosterone can cause multiple things, okay? First and foremost, it can accelerate atherosclerosis, liver failure, it can put you at higher risk for stroke and heart attack. It can cause issues, not so much causing prostate cancer, that tends to be a misconception, but if you have a small focus of a prostate cancer, you run the risk of that prostate cancer growing and causing issues. With that said, having a very low testosterone can also cause this. And so I think it's really about balance.
And Dr. Martinez, when does a man need to actually come and see you, right? If this is part of the aging process and there's not really a big intervention you're recommending, when do they actually need to see their urologist?
So I'd say somewhere potentially in around between their 30s and 40s, a man may want to make an appointment with a urologist, depending on whether or not they have some sort of family history of a urologic issue.
So I think the most important question we can ask you is, how do you get your husband to go to the doctor, right? Men never seem to want to go to the doctor. They'd rather take care of their car, make sure they get the oil checked every year, but they never seem to want to go to the doctor. So how do you even get someone to come see you?
There really is no easy answer there. I know us men, and it has to do with our testosterone, it makes us very stubborn. It's difficult, but I think making them aware of the risks, making them aware of the way they feel when they're young, if they want to continue to feel a certain way, I think that's the important part of going to see the doctors, maintaining good health. When we're in our 20s, we feel indestructible, because technically we are, but when you're in your 20s, really, those are probably some of the more important years. You want to maintain good health in order to have that good building block so that when we grow up and we are in our 40s or 50s, we haven't burned any bridges, because we have one body, we have to protect it.
Absolutely. Dr. Martinez, thank you so much for joining us here today. I think the key takeaway is that there is no silver bullet for menopause or menopause.
Absolutely not.
And we want our viewers to stay healthy and be well this summer. Thank you so much.
Thank you so much.